Have you felt burning in urine after sexual intimacy? It is also very common. I am Dr. Shilpa, gynecologist practicing at Harley's clinic in Mumbai in Andheri West. This is one of the very common things that we see in the practice is about the urinary tract infection that happen post sexual intimacy. It is true that UTIs are common. It is true that sex is also one important reason why you can get it. Because of the nature of the sexual intimacy, the vaginal flora get an access to the bladder and thereby causing an infection. We all know about urinary tract infections. There are two types of UTIs. UTIs is sometimes we call it as a lower urinary tract infection which takes the urethra and the bladder, and we also call it as an upper urinary tract infection which involves kidney. Lower urinary tract infections can happen by sexual intimacy, as I mentioned. It can happen because of drinking less water, it can happen because of poor hygienic conditions, it can happen because of improper clothes sometimes. Quite a lot of reasons we can get it. It is not the infection only restricted to girls, it is an infection that can happen to boys as well. Though there is no doubt that we as a girls we get it more often than the boys because of the small length of urethra. How do we diagnose a urinary tract infections? We diagnose UTIs with the clinical judgment, and we use the investigations to confirm our diagnosis. In the clinically, what we feel is burning in the urine, feeling to pass urine more frequently, it is painful, sometimes there is blood which peeps in, sometimes there is infection that travels to the kidney and we feel the pain in the back. In the UTIs, we ask them to get few urine tests which takes urine routine, culture, and sometimes get the blood test to see the condition of the kidney as well. We also advise a sonography to find out there is no other reason like a kidney stone or a bladder polyp or anything else that can present or mimic like a urinary tract infection. So how do we treat a UTI? We treat UTIs by antibiotics, but they have to be taken under the medical supervision. Taking it from the chemist is nowadays causing a lot of sensitivity, lot of resistance against the bacteria. We have to use higher and higher amount of antibiotics, stronger and stronger amount of the dosage is given to handle the situations. So the important part would be how we can take care of a UTI. The best is the prevention is better than the cure. What are the things we can do to prevent a UTI? We can prevent a UTI by anticipating it can happen, especially when we travel. So keeping a check of how much water we take when we travel is very important. We all have a habit that we don't want to use the washroom outside, thinking we will get a UTI by using an outside washroom. It is not the washroom that will give a UTI. It is holding the urine for a long time, trying your best to avoid that washroom, drinking least amount of water so that you don't have to use that washroom, and in the end you will land up using the washroom and you get a UTI, and again you feel that I never wanted to use this washroom, see I got a UTI. So UTI is first thing is anticipation. When you travel you have to make sure that you drink good amount of water. You should not hold a urine for a very long time. Taking care of your garments, using cotton breathable garments, not wearing like tight things, especially when you travel. Taking care of the sexual hygiene, passing urine before and after the act, cleaning your parts before and after the act, very important. Third common reason is, of course, the immunity no doubt plays the most important role in anybody getting any infection. Diet, exercise, good habits goes without saying that to manage a immunity which can fight against the bacteria and fungus. If you have any questions related to UTIs or related to why sexual intimacy is associated, you can get back to me. Thank you.